Welcome, Vicky. So lovely to have you, and it's so great.
Thank you
Super.
so much. Honored to be
Oh
here.
my goodness. Yes, absolutely. I just want to give a quick little intro to you. So Vicky Warr is the founder of Bump and Beyond, which she's a pregnancy and postnatal fitness expert and specialist. And she's got over 20 years of experience in the fitness industry. She's been fortunate enough to work with pregnant women and mothers of newborns, toddlers, and young children from all over the world to help them to be fit, toned, and strong through all stages of motherhood. Her Bump and Beyond fitness method is based on her many years worth of training clients online and face-to-face, and keeping up to date with the latest research in the world of pregnancy and postnatal exercise. Her method is designed to improve core strength, whole body tone, and fitness during pregnancy for the marathon event of birth. And you know that I've got a big thing about that, so I'm just admitting people as we go. And after pregnancy, her method focuses on re-strengthening and healing the abdominal muscles with attention to fixing abdominal separation, known as diastasis recti. And I'm sure many of you have heard of that. After this stage, her method progresses to toning, tightening, and flattening the tummy muscles. To date, she has helped over 20,000 women worldwide to have a fitter, healthier pregnancy and to recover faster, to reduce abdominal separation and lose inches of their waist after having a baby. She's the go-to writer for Gurgle magazine, and she regularly works with the best women's health physiotherapists and women's health experts. Her method is recommended by Queen Charlotte's Maternity Hospital in London and obstetricians and doctors in the USA and UK. So, Vicky, I'm so delighted that you are joining with us today, and I know that your program is going to be available to all the members of the Due Date Club, and I'm so excited to be able to have that and to be able to offer that. So, welcome.
Thank you so much. I'm honored to be here. Thank you for the introduction, and congratulations to all of the pregnant women that have joined today. I'm honored to be part of the Due Date Club Launch Summit. So thrilled to be here.
Vicky, do you have a presentation that you want to share? Or you do? Okay. Are you able to share your screen?
I am indeed. So bear with me. All right. Just getting this up. All right. How's that looking? Can we see that?
That's fantastic. I can see that. And I don't know if you want to maybe, oh, that's perfect.
All right. Okay, are we getting started?
Let's do it.
Let's do it. All right. So first of all, I would just love to hear from everybody that's here, that's listening. Let me know in the chat box below where you are in the world, and also how many weeks or months pregnant you are. What stage of pregnancy you're at? Because I just love to know that, first of all. So we are going to be talking about the 7 common pregnancy exercise myths, and I'm going to bust some of these myths for you, because it's well documented now that exercise is such an important part of your health during pregnancy. It benefits both the mother and the baby. But when you go and kind of Google exercise in pregnancy, because obviously you have a lot of questions that you might want answers to during your pregnancy, because you want to keep everything safe for both yourself and your baby, a whole plethora of information can come up. All right, from, don't lie on your back to what you can't do. So I really wanted to share some misconceptions with you. I've done a load of research, and these are evidence-based evidence-based answers to the myths, and I wanted to share this information for you so that we can clear up any confusion surrounding exercise in pregnancy and really get you good exercise. And I want you to know that this is so important. If you were going to be training for a marathon, you wouldn't just kind of go and do a little bit of walking and kind of sit around on the sofa. You would train for the marathon, right? Well, giving birth is an endurance event. It requires a lot of fitness and a lot of stamina, or it requires stamina, right? So to do that, you want to train your body for the lifetime event of birth. So let's get into these 7 common myths. And I also want to just make a note here to you that there's more than 7, but I've picked out the most common ones that I hear on a frequent basis and I get asked about. So myth number 1, don't lift your arms above your head. You may have heard this one a lot. Okay, so this kind of came about, this whole myth and this piece of advice came about from years ago. It's kind of an old wives' tale where it was thought that lifting your arms above your head could cause the umbilical cord to wrap around the baby's neck. Now, what we do know is that your arm movements, all right, going up, going out to the side, are not connected to the umbilical cord or the fetus in any way. So, you know, this is a true myth. And also, you've probably noticed in everyday life that you are reaching up to put something up onto a shelf. You may have another child, a toddler, for example, that you want to pick up whilst you're pregnant with your other child. You know, mummy up, you probably heard a lot. So you're picking up your other child. I know I was with my second pregnancy. I was picking up my 3-year-old at the time a lot, carrying him around. And you're also reaching back to things, put things behind you. So you're lifting your arms above your head in everyday life. So, you know, realistically, to not lift your arms above your head would be really quite tricky. Now, there are some precautions that you do want to put into place if you are lifting weights, for example. So if you're using weights, for example, in the gym or at home, then like shoulder presses, then this is absolutely fine, by the way, but take on board these couple of tips that I'm going to share with you. Lifting the weights overhead without attention to posture during pregnancy or activation of the deep core abdominal muscles may lead to kind of you excessively arching your lower back. Now, this kind of offsets your posture. You've already got, I'm going to stand up here, a huge, well, not a huge, that's an exaggeration, but you've already got this lumbar spine hyperextending slightly during pregnancy as you carry your baby in front of you and as your baby grows in front. So we just want to make sure we're not hyperextended even more as we're lifting our arms over our head. So really pay attention to your posture when you're doing weight exercises at home or in the gym. And be sure to exhale on the exertion phase of the exercise. All right, so when you're doing the shoulder press, you want to be exhaling as you're putting your arms up overhead. All right, so that's number 1 myth busted. All right, we'll move on now to the second myth. All right, so myth number 2. I'm just going to move this down, only lift super light weights and nothing over 10 pounds. Now, again, I've heard this, I've seen this onto the internet. And there was a past assumption that lifting weights or strength training exercises may be too stressful for the body during pregnancy and cause some injury. However, this is not the case because supervised, regular, moderate to vigorous strength and resistance exercise has no adverse effect on childbirth outcome, pain, or blood pressure. And there was recent research that was written into a paper by the ACOG, American College of Obstetricians and Gynecologists, that actually researched into this. And in fact, strength training, so that is training where you're either using your own body weight and doing various exercises like squats, lunges, some rotational moves, which we'll talk about in a minute, arm body strength training exercises. All of these are going to be super beneficial for you when you come to have your baby, because you're going to be lifting suddenly what could be a 4-kilogram weight around 24 hours a day. So you do want to build your strength during pregnancy with the right kind of exercises. It's so important. And also, If you have a toddler and you're pregnant, the toddler is likely to be weighing more than 10 pounds. All right. So this is really quite a myth, because also if you have a job where you are lifting during the day, and you're lifting sort of packages or whatever your job entails, but it involves lifting, then you could be lifting more than 10 pounds as well. So realistically, again, this wouldn't be dangerous for your body. If you're used to lifting in your job, then you can continue to do so. During pregnancy, you might want to reduce the amount of weight that you're lifting as your pregnancy progresses, to keep everything safe and just to make sure that you're not overexerting yourself. And of course, as long as your doctor hasn't advised you not to lift anything due to a complication with your pregnancy, then it is safe to lift more than 10 pounds. All right. If you encounter any pelvic pain, any leaking of urine, or any downward pressure or heavy kind of dragging sensation, all right, within your pelvic floor, in your pelvic area, or within your vagina, then you may have some excess of inter-abdominal pressure. So sort of excessive pressure. You want some pressure, you don't want too much. So in this case, stop lifting the weight and seek the advice of a physical therapist or women's health physiotherapist that can help you with any pelvic pain you might be experiencing. And also use the talk test, which we're going to come onto in a minute, to monitor the intensity of your training. So this is where you can hold a conversation when you are exercising. Never hold your breath when you're lifting any weights. Make sure you have your breath continuous and exhale on the exertion phase of movement. All right, so we'll move on now to myth number 3. Don't rotate or do any twisting movements. So to twist or not to twist during pregnancy, this is not a total myth. Some rotational movements and exercises are hugely beneficial to you because, in fact, again, in everyday life, you are turning around to put a child into the car seat. You're turning around perhaps to talk to somebody. You are turning around to reach for something. All right. So in practical life, we're turning around all the time. Okay. During pregnancy, you do want to avoid any really fast, dramatic, full twisting. All right. That should be kind of minimized. All right, in terms of myth number 3. So some rotational movements, and I have a lot of rotational movements in my program, Prepare, which prepares your body and keeps it toned and conditioned during pregnancy to have an easier pregnancy, where we're using a soft core training ball like the lady in this photo here, and we're turning to about a 45-degree angle to really activate our deep core muscles, which the ones you want to strengthen during pregnancy, because they are the ones, the transverse abdominis, that you want to be using to push your baby out. And when you have a strong core, it will help you facilitate and have the ability to do that. So we're going to move on now to myth number 4. So myth number 4. Oh, I'm sorry. Where? Let's get that back. I didn't pause it. Bear with me. All right. So myth number 4. Don't do any exercises for your abdominals. All right. So I love this one because it's such an important one. So this is partly true. All right. But it's so important to know what kind of exercises you are going to be doing. So an old wives' tale said that if you did abdominal exercises during pregnancy, it could cause a miscarriage. However, again, recent research from the ACOG states that exercise in pregnancy is associated with minimal risks and shown to benefit most women, as long as there's no severe complications. As I have just mentioned in myth number 3, you really want to be training your deep core muscle. This is so, so important. Your transverse abdominis, it wraps around your entire midsection, goes from your spine, wraps around into your front, and is connected to your pelvic floor. Really important that muscle is trained during pregnancy, because that is the muscle responsible for pushing your baby out. All right, hence you want it to be strong. So in terms of what kind of exercises to do for that particular muscle, you want to make sure that you're doing exercises such as a foot and an arm slide on your hands and knees, a knee lift and a slightly small rotation, a hip bridge, kneeling squats are really good ones with an inner thigh ball squeeze, and also a wall plank as opposed to a plank on the floor. Now that leads me into just explaining very briefly that you want to manage abdominal separation, which naturally occurs during pregnancy. It really is where the linea alba, which is full of connective tissue that runs down your midline here, is stretched due to the baby and the fetus growing inside you. So and it's a naturally occurring process. Nearly 100% of women will have some abdominal separation during the third stage of the pregnancy, during the third trimester. Naturally occurs, it stretches that connective tissue, which distances the paired muscle known as the rectus abdominis, or your six-pack. It just creates this distance between that paired muscle. It's one muscle that is in two pairs, right and left halves. All right, so it will distance. Now you want to manage that process, make sure you're not weakening that connective tissue further by any real downward pressure movement. Everybody is very unique with this, so you just want to watch out for any coning at that area, any triangular shape forming, or any kind of pointedness going on in that area. That's why I always say, try to, if you like a good old plank exercise, try to do that against the wall. You'll have less pressure on that connective tissue. Now, the sort of exercises you want to avoid are sit-ups and crunches, where you are lying on your back and coming up forward in a forward flexion movement. These just target that rectus six-pack muscle. And you want to be targeting, remember, that transverse abdominis muscle during pregnancy, but also after you've had your baby. That transverse abdominis muscle also keeps your spine stable and your back supported. And of course, the center of gravity is being compromised during your pregnancy. All right, so that's very, very important. You want to minimize any back pain that you might be experiencing during your pregnancy. So keeping that muscle strong with the right kind of exercises that I just mentioned is so, so key. So sit-ups, full planks, avoid those, all right, because they are just purely targeting that upper superficial muscle, and you also got that forward flexion going on, not hugely comfortable for your bump, right? All right, let's move on to myth number 5. So avoid doing exercises lying on your back or in a supine position. All right, so what's going on here? I'm going to really clear this one up for you. The size of your uterus increases at about 20 weeks of your pregnancy. And if you're lying on your back, it will kind of be positioned on top of the vena cava, which is the very important blood vessel that pumps blood to your heart. So this can kind of potentially reduce the blood flow back to your heart and potentially to your baby. Now, there was one very, very, very small study which showed a potential risk of stillbirth for women who slept the entire night on their back. But you've got to remember that this is hugely, hugely unlikely because most women and most of us, whether pregnant or not, get up to go to the bathroom during the night. If not once, then several times. And also we shift around during the night, going on to our sides, when we're sleeping. All right, so generally a small amount of time on your back is safe as long as you're not feeling dizzy, uncomfortable, short of breath, or in pain. All right, so if you're experiencing any of that, then it's time to kind of come into a seated position and standing up slowly and rolling onto your side, so you're not straining connective tissue, to come up to seated. So, of course, you're sleeping as well. So don't be alarmed if you wake up and you've been sleeping on your back. You mustn't be alarmed by that. All right. It is generally, okay for you to lying on your back as long as it's not for long periods of time. Now, when we kind of try and clarify what a long period of time is, it's very individual. Okay. So it's difficult to say. You just wouldn't want to be hanging out onto your back for lots of hours. All right. But if you're doing an exercise such as the hip bridge, which is hugely beneficial for strengthening your glutes and helping protect your back, then you can be there for a couple of minutes or so, and that would be fine as long as you're not experiencing dizziness. So just watch out for that. All right, moving on to myth number 6. Yes, so stay between 140 and 150 heart rates. You may have heard this, that during your pregnancy, you must stay between this band of 140 and 150 heart rate. And you might be using a heart monitor to kind of to monitor your intensity of your exercise if you're exercising during pregnancy. So years ago, fitness experts recommended this. However, one number, this 140, 150 heart rate number, doesn't allow for individuality in terms of different fitness levels, different resting heart rates. We all have different resting heart rates. We have different fitness levels. So for some people, 140 beats per minute can mean that they're not really out of breath, not quite doing enough. All right. For some people, it might be really, it might be really, really getting out of breath. And of course, if you've ever walked up and down the stairs during pregnancy, because of the 50% increase in blood volume pumping around your body, you'll notice that you've got out of breath far more quickly. So the better way to monitor the intensity of your exercise is to simply use the talk test. And this is where you can check to see if you can hold a conversation when you're exercising. So if you can just, speak, hold a conversation. If, however, you can recite a nursery rhyme, then you're probably not doing quite enough. It's probably not quite challenging enough for you. So just be aware of that. So let's move on now to myth number 7. Now, I don't want to get my knuckles slapped for this one by any prenatal yoga teachers, because prenatal yoga, all right, and walking are both super beneficial during your pregnancy. So myth number 7, you should only walk and do prenatal yoga when pregnant. So I just wanted to be really clear that prenatal yoga and walking are super beneficial during your pregnancy, but they're not the only means of exercise. All right. So I find that in my local community here in the UK, really the amount of exercise, strength training exercise that's available, that's supervised, and specifically being devised for pregnant women so that they can train for the marathon event of birth and be strong for when they come to have their baby and do all these mummy activities of lifting and carrying, being able to do that when you've had minimal amount of sleep. The missing ingredient of a good pregnancy fitness program, or any fitness program for that matter, is strength and conditioning exercise. So this is where you're using some hand weights, resistance bands, or your own body weight, and you're doing exercises that are functional and mimic everyday movements. So for example, squatting is where you are literally squatting down to reach something up off the floor. You're lunging to get something up off the floor. All those kind of movements you want to be strong and capable of doing. And strength training is seen as very, very beneficial, but it's still often overlooked and underrated. With terms of prenatal yoga, it's such a fantastic form of exercise, and I do recommend it. It keeps you supple, it keeps you flexible. There's some movements that you do want to avoid, but that's for another separate conversation. And walking is also very good for your fitness and your stamina, but you should be doing this anyway. The ACOG cites that you should be doing between 20 and 30 minutes of moderate intensity exercise a day, every single day. All right. So if you are saying, oh, well, I'm walking a couple of times a week, well, that really needs to be notched up to every single day. Walking is something you should be doing anyway. All right. It's general activity. It's good for your body. It keeps your tissues gently stretched, and it keeps your joints mobile. And when you're carrying that additional weight out in front of you, it's so important. All right. But it's not the be all and end all, and you really want to be incorporating strength and conditioning training into your pregnancy fitness program, and you can start it if you haven't done any before. I have had both women on my online programs, and also I've seen face-to-face that have started strength and conditioning exercise during their pregnancy and benefited hugely from it and had quicker recoveries after they've had their babies. All right, so important. All right, so that wraps up my 7 myths. I want to just take a pause here and give you my top tip. As a pregnancy and postnatal fitness specialist that's been in the industry for over 20 years, and I also have 2 children of my own, one who's 13 and one who is 10. So I just reaped and realized how beneficial strength and conditioning exercise is during your pregnancy, and also when it comes to recovering after you've had your baby, to keep these deep core muscles strong. You want to prepare your body in the best possible way for the lifetime endurance event of birth. So as I mentioned at the beginning of our talk today, if you were training for a marathon, you wouldn't just kind of meander around and do a little bit of walking and sit on the sofa. You'd properly train for it so that you didn't get into injury and pain. Same with birth, all right? So you want to be protecting your back. You want to be getting these muscles strong so that you can be doing all those activities of a mum. So lifting, carrying, picking up things off the floor. You do want to be comfortable during the exercise whilst keeping it challenging enough for you. So always be going for comfortable positions during exercise. And I teach this on my online program, Prepare, what positions to get into when you're doing the exercises, how to get into them and how to transition safely up off the floor so that you're not straining that connective tissue at your midline. And exercise, the type of exercise that you choose should not hinder your recovery postpartum. So things like contact sports during pregnancy and anything high impact is going to have an effect on your pelvic floor. So you want to be doing low impact exercising during your pregnancy. All right, exercise that supports you, but still movement. All right, so important. Your exercises also need to appeal to you. They need to be time efficient, especially if you have other children and toddlers, and give you the desired results. You don't want to be spending hours kind of doing some exercise and it's not beneficial to you or your body. And also it's got to be enjoyable. You've got to enjoy your exercise rather than it feeling like it's a chore. Be consistent. Please be consistent. All right, this is so important, even when you don't kind of like it. You've got to get that blood circulating around your body. So it's so important that you are consistent with your exercise. If you can only fit in 10 minutes a day, that's great. All right, just be consistent. And then maintain and even improve your strength, both in your mind and your body with your exercise choices. On that note, I'd love to play you a quick, short little video, which gives you some examples of exercises that I show on my Prepare program and which you can just do at home. So there you go. That was myself and Uma, lovely pregnant lady who is now 37 weeks pregnant, just giving you a little clip there of all the kind of exercises that you can be doing to strengthen your body during your pregnancy. And if you would like a fit, toned body during your pregnancy, but more importantly, to potentially set yourself up for an easier birth and a faster recovery, then I would invite you to book a free call with me. You can do that by just either copying and pasting the link there on my slide, calendly.com, bump and beyond /prepare your body for birth, the best way discovery call. It's a quick 20-minute call and you can talk me through any struggles that you might be experiencing, what you really are unsure of about exercise during pregnancy. And we can see if my Prepare program could be a fit for you. So I just want to make sure that you are aware that this is not a sales call in any shape or form. This is just a call to find out if you are struggling with anything, if you want to get going with exercise and you're not sure about how how to do that, then it may be that my Prepare program is a fit for you. So be sure to click that link and book your call with me. And if you have any questions, I'd love to hear from you. You can email me after this, vicky@bumpandbeyond.club. So it's been a pleasure presenting this information to you today. Thank you so much for listening. And be sure to connect with me on YouTube, Bump and Beyond. You can search it there. And also Instagram, Bump and Beyond Club, and we can hook up via social media and connect that way. I also have an amazing special deal as well for the due date club members, which we can talk about, but I have a special offer for you for my Prepare program. So we can give details, I believe, of that after this summit, I believe, Karen, can't we?
We can. Thank you so much, Vicky. We're definitely going to be sharing details of that in the follow-up emails. And also to let everybody know that Vicky is very much part of the Due Date Club, and she's going to be coming in once a month to chat to everybody, to answer questions, to ask, talk about pregnancy and postpartum fitness, and that her Prepare program will be available for Due Date Club members at a hugely discounted rate, which will be sharing the details of that with you. Vicky, would you mind stopping the screen share, because I see we're starting to get some questions, and then yes, everybody, you can feel free to pop your questions in the chat box. One of the questions comes from Leanne, and Leanne's actually in our Relax into Birth Plus group. So Leanne, lovely to see you here, and thank you so much for joining. And she's asking if you've got any exercise programs for postpartum, and I know that you have. In fact, I know that your postpartum program is like off the charts awesome. So maybe you can just share with Leanne about what that is and how it works.
Hello, Leanne. Yes, if you've had, hello, Leanne. Nice to have your question. Thank you so much. So yes, my postpartum program is very much, it's in 2 phases. So we re-strengthen and rehab your abdominal muscles after you've had a baby, which is so important. In the first phase, which is a couple of weeks long. And then in the second phase, we go onto the tone tightening and flattening phase of the program, which is where we really kind of get to grips with toning and flattening the abdominals, which I found that the people that came to me, that's what they wanted. But we have to make sure we go through the phases. It's a progressive program. You'll know exactly what to do each day, and it's purely video based, but also you have a load of personal support to help you along the way. So it's a structured, progressive program, which is very different just playing an ad hoc exercise video. And it takes you through the correct stages so that we can heal up diastasis recti, which is abdominal separation. We can get that all back together again, get the tummy muscles back together again, and then go on to the toning and tightening phase as well. So you have exactly the kind of exercises in lovely little exercise routines from 10 to 25 minutes on most of the days, so they're easy to fit in. And you have weekly personal support from me as well in terms of a live video coaching call, and you can ask any questions you have during the program at any time too via our online chat. Yes, it's all hosted on a very great platform where you log in, you have your own login, and you can log in via a desktop or also a smartphone as well. So it really is for you if you just really want to get your abdominal muscles strong again, you want to heal that diastasis recti, and you want to get a flatter tummy. I hope that answered your question, Leanne. And you can access that. You can access that by hopping on a call with me. If you could get in touch with me at the email address of vicky@bumpandbeyond.club, I can send you over a quick link to hop on a call with me, and we can see if the program is a fit for you.
Vicky, thank you so much. There's another question. Thank you. Well, first of all, thank you for your amazing presentation, and then asking what your thoughts are on using a postpartum belly band to help diastasis recti.
Yes, great question. Love this question. So yes, they can really help. Be careful about which ones you choose. I have always recommended belly bandit personally. What you just want to avoid doing is relying on the belly, on the belt to try and strengthen you. So what I recommend is that when you come to do the exercises, which you really, really want to be doing, okay, the exercises are important. You mustn't kind of skip that part and just go with wearing a band, try and re-strengthen. You've got to be doing the right exercises for your body. When you're doing the exercises, I recommend you don't wear the band, because the breathing, all right, I know it can sound boring and it's like, we all know how to breathe. However, during pregnancy, your diaphragm lifts, is compressed by the baby growing inside you, and the breathing patterns can kind of go all out of sync. And you need to be breathing correctly with your diaphragm muscle, because your diaphragm muscle is connected to your transverse abdominis muscle, and it's all connected with your pelvic floor. You have a whole system going on in here, which you want those muscles, and the diaphragm is a muscle, your breathing muscle, to be connecting correctly. So you've got to be learning how to breathe and activate the deep core muscle during exercises, but also during daily movements as well. And I teach that actually in my Prepare program, but also in the postpartum program. And along with Uma, we show you how to breathe at the right point of lifting something up off the floor, because, hey, so much damage can be done when we're just picking something up off the floor and we're not recruiting the muscles correctly. And that's when we can get backache and not be activating these deep abdominal muscles. All right. So yes, by all means, wear the belly band, because it can help you just feel a whole lot better as well after pregnancy as well, about your abdominal muscles. But avoid relying on it all of the time to strengthen. You do need to be having the right kind of exercises to do that. I hope that answered your question. Great question.
Thank you so much, Vicky. A question from Sarah Goodwin. Does your postpartum program start at 6 weeks post-vaginal birth or earlier? And then the same question for post-C-section.
Yes, love this question as well. Thank you so much. You can start the program earlier, because some of the exercises are very gentle. And this whole 6 week thing, which is time for another conversation, I must do a video on this, is a tricky one, because women can not exercise at all for 6 weeks and then wham, bam, straight back into the wrong kind of exercises, or back into the gym doing general exercise without re-strengthening, all right, that connective tissue and those deep abdominal muscles first. So going back into doing kind of high impact exercises, you want to modify those for low impact exercises, and also be careful of your pelvic floor. Pay attention to your pelvic floor, make sure you're strengthening that too. So yes, you can start my program before 6 weeks, and there's a special advice for C-section as well. All right, these kind of women are close to my heart. I see so many women now having C-sections, either emergency or elected, and it is trickier. It's a lot more challenging to kind of find those muscles again, but it can totally be done. And if you want to check out, first of all, a couple of my YouTube videos, I have a selection of C-section videos on my YouTube channel, Bump and Beyond, by Vicky Warr. Just search that into YouTube, and you'll see some C-section videos if you just want to kind of check those out. But also hop on a call with me too, Vicky@bumpandbeyond.club, Vicky@bumpandbeyond.club, and I'll send you a link and we can hop on a free call. But great question.
Vicky, I think you've already answered this, but there is a question about when you've had a C-section, how long after can you start exercising? So maybe just addressing that specifically for that question.
Yes, this is great. That's more specific. So again, a great question. I get this asked a lot. So again, your doctor or your obstetrician might say to you, don't do anything for 6 weeks. And then wham, bam, what do you do after 6 weeks? You know, what kind of exercise do you do? Now, again, it's very individual. There are a lot of exercises you can do before the 6 week mark. And these are going back to, and please don't think this is boring, because it's essential. It's the foundation of a postpartum exercise program. The correct breathing and timing the correct breathing using your diaphragm and really trying to tighten the transverse abdominis, all right, and really strengthening the pelvic floor muscle, but also learning to relax the pelvic floor muscle as well, so it's not hypertonic. All right, you want to be doing those kind of exercises prior to the 6 week mark. All right, they're gentle. Then, you know, they're not wham bam, you know, high intensity, I'm going to really feel this in my abdominal kind of exercises, but they're going to help you connect your mind back with your muscles. We lose muscle memory, especially after a C-section. It's traumatic surgery. On that note, if you had knee surgery, it would take about 9 months, all right, to recover from knee surgery, and you'd be doing rehabilitation exercises. Same thing with a C-section. All right, you can start earlier than 6 weeks, but we're talking rehabilitation exercises where then you gradually, progressively have more challenging exercises over the course of time, as long as you've strengthened correctly. And in my postpartum program, we have stages to do that, so that you have a little checklist about how you know when you're connecting to the muscles correctly, and you'll start to feel them. And I incorporate some lovely C-section massage in there as well, just to break down all those scar adhesions, which you have, which can kind of just mean you can't feel the abdominal muscles, and it feels kind of numb. All right, so that's something that we do as well to really get things moving again, and getting this whole mind body connection back, because we kind of switch off for the muscles. We don't like the muscles anymore. We don't like how they look after having a baby. So we've got to be kind to them and get the relationship going again, mentally, as well as doing the right kind of exercises. But yes, I waffled on there, but you can start those exercises prior to 6 weeks, as long as you're not having any pain in your scar isn't infected in any way that you need to get checked out, if that is the case. Great question, thank you.
Right, fabulous. One more question, if you've got time.
Yes, of course. I love questions. Bring them on.
I know, I'm loving it as well. It's fabulous. So do you have any advice regarding carpal tunnel syndrome? Is there anything additionally that one can do besides your soft tissue release, ultrasound and stretches? Now, I'm not sure if this comes into what you do, but I'll leave that up to you to answer.
Oh my goodness, I love this question, because I suffered from it so badly with my, I think with both actually, particularly my second pregnancy. And I actually had to sleep with kind of supportive gloves on my hands, because I felt it during the night as well. So carpal tunnel syndrome, yes, where it can affect, I won't go into it too much, but where it affects your wrists. So really, you want to be getting some gentle movement into your wrists. So you want to be doing gentle wrist circular movements, and then also back the other way as well. You want to be just gently coming up and then gently going down, and do these, throughout your day to really, really help you. So just gently movement through the waist, because what can happen is you get little blockages and the blood's not circulating correctly around this particular joint. When you're coming to do any exercises, I always recommend kind of, instead of bending your wrists, especially if you're onto your hands and your knees, then resting onto your fists. You can also just hold on to some very light weights, so that you're keeping your wrist in line, all right, with the rest of your forearm, so you're not bending it back too much, which can place extra stress. So just be careful when you're onto your hands and knees, onto the floor, for example, rest onto your fists. So they would be my initial tips. And then also I would definitely recommend seeing a physiotherapist. A women's health physiotherapist would be more beneficial to you, because they would understand the implications of pregnancy and carpal tunnel syndrome. You've got a lot of hormones going on, which are going into all of your joints, in particular relaxin, which makes the joints a lot more lax. It prepares your pelvis and the birth canal for birth. But the relaxin is not clever enough to know what kind of joints to go into. So it doesn't just go into your pelvic joints, it goes into all of your joints. So increased hormones, and every woman is different with the amount of relaxin they release. So you could be suffering from it quite severely, which I did, and some women can just have a little bit of pain. But I hope those tips have helped you. I can't quite remember, in all honesty, what kind of gloves I wore. I think it was kind of ski gloves, to be honest. I didn't invest in anything particular, but it just gave me that little bit of more support around the wrist, so I wasn't, hyperextending too much at that area to make things worse. I trust that answered the question.
Vicky, are you back? I don't know, I lost you for a moment, but
yes, it seemed that way.
Yes, I think you froze for a moment, but anyway, one more question.
Yes.
Starting scar tissue massage for C-section adhesions, when would you suggest starting this?
Yeah, so again, it depends on the woman and how the scar has been healing. You can start Usually they do say after about 6 weeks. If you just gently, however, go around the scar, so not actually touching the scar, just the area around the scar, like about an inch or a couple of centimeters just above the scar and below, just with gentle sweeping movements from left to right, then that will help, and you're not kind of touching the actual scar itself. If your scar has healed, you're not having any infection, then you can just gently go onto the scar with your fingers. You're not wanting to create any pain, but you're just wanting to feel kind of some release, or just to try and attempt to reduce the numbness in that area, and women can feel numb for months and months and months and months afterwards. All right, don't be alarmed by that. It's sometimes a kind of a mental blockage to the muscles as well. So it's just, trying to be kind to the muscles, understand that you've had a baby, they look different now, right? But nothing, untoward. It's all a natural process, and they might look different, but you can get the strength back if you're doing the right kind of thing. So yes, I would say if your scar is not infected, then try to massage around that area, sweeping movements from left to right. Okay. And if the scar is infected, obviously get that checked out first and that healed up, then move on. But usually around about the 6-week mark. And it's really important. It's a great thing to do. You only need to spend a couple of minutes doing it each day.
Thanks, Vicky.
You're welcome. Oh, I thought I'd frozen again there for a minute.
No, you're back. I know. I don't see any other questions, but I just wanted to take a moment to thank you so much for focusing on those myths, because they're so rife, and just to be able to clear up the things about lifting your hands above your head, safely being able to do twists, and being mindful of the fact that, whatever you're doing during pregnancy, you're going to be doing straight after birth. And also taking into account the level of fitness and your strength and stamina before pregnancy. So often I see moms who haven't done anything and then embarking on a huge big fitness and strength training program to really be gentle and work with their body as they move into preparing their body for pregnancy, working within their own limitations.
Exactly that. I love that, Karen. Yes, working within your own limitations, and really pay attention, listen to your body. If something intuitively doesn't feel right, you notice kind of downward pressure, your position doesn't feel right, don't just do the exercise because somebody else is doing it. Do a different kind of exercise for that particular muscle group, or change the exercise up a little so that it's comfortable for your body and it feels right.
Absolutely, especially in pregnancy, because pregnancy really is about learning to tune in and trust your intuition. And there isn't a better way of doing that than becoming aware of your body and how you're feeling in your body in resting moments, and when you are exercising, moving, walking, swimming, doing yoga, doing strength training. We are connecting with our body and really tuning in and seeing what feels. And the more we can do that, the more easily we're able to access our intuition and our body and what our body is actually telling us.
That's right, Karen. It's all about trust. And in fact, Karen, I'm hugely excited, is going to be doing some of her lovely prenatal meditations as part of our Prepare program, where you were exercising and then coming down and listening to the lovely Karen doing her prenatal meditations to really help prepare your body and trust your body for the birthing process.
Are there any other questions from our lovely listeners? And yes, Vicky, I'm really excited about that too, actually. It's going to be an amazing program and such an important part of the preparation. So we still have 30 plus people on the call. Is anybody got any other questions for Vicky before I start preparing for our next speaker? And I'm so excited to have our next speaker on, because it's perfect to go from preparing your body physically for pregnancy and birth and postpartum. And our next speaker is going to be talking to us about the importance of preparing mentally for pregnancy, birth, and beyond, and how you can do that using hypnobirthing techniques. So I'm gonna wait another few minutes for anybody who is still got something lurking that they would like to share with us. And if not, then
I saw a little message there from Shiny. Thank you, Shiny, for saying thank you. I appreciate that hugely.
And Sarah, thank you as well. Sarah, I don't know if you saw earlier, Vicky, that Sarah's a physio.
Oh, Sarah, hello.
Yeah, so she said, thank you so much. So she's, obviously also coming at it from that point of view. So
Yes.
Sarah, thank you so much for your input and your feedback. It's really, really lovely. And it's just so lovely to get such a lot of engagement and participation from all our participants, and for everybody for taking time out on a Saturday morning to join us here today. I'm very excited about this. I'm very excited about the Due Date Club and all the things we're going to be able to offer there. And the fact that everybody who's speaking today has got some offering and is part of this Due Date Club.
Just check.
Priscilla from Kenya, glad to be part of this. Oh, lovely. We've got somebody from Kenya. Welcome.
Oh, welcome.
Yes. Is there anything you would like to say in passing, Vicky? Anything you'd like to share, like I don't know, you've given so many tips. I'm not sure if you can give any more, but anything else you would like to share with us?
Oh, yes. I haven't mentioned our little giveaway. Oh, my goodness.
Yes.
How could I forget this?
Yes.
So, what I wanted to mention quickly was there is today, for all the people that have attended live, a free chance to win a place on my Prepare program. All right, which is worth $250 if you're just purchasing the Prepare side of the program. What I want to know from you, all right, in order to be put into the prize draw, as it were, is why you want this program in 12 words. All right, so why you would want this program. I would love to know that. So what you can do is you can email me, vicky@bumpandbeyond, all lowercase, all one word, .club. Don't forget it's .club, not .com, not .co.uk, .club. All right, bumpandbeyond.club, Vicky, VICKY. All right, if you can email me with the answer to why you would want my Prepare program in 12 words or less, then I will enter you into the free prize draw and I will announce the winners.
And I am putting that at why you want the Prepare
program. And the Prepare
12
program,
words or less.
Yes, that's right.
Fantastic. So I've put that into the chat box for everybody. I will get that off quickly. And then one lucky person is going to be winning a subscription to the Prepare program, which is an online pregnancy fitness program which guides you through a structured exercise program with fully instructed pre-recorded exercise videos from trimester 2 to the birth of your baby. There's also nutrition tips to guide you through nausea and morning sickness whilst nourishing your body and creating a healthy start for your baby. You'll be able to exercise safely and comfortably for your body and your baby, having peace of mind knowing that the movements you do have been thoroughly researched and designed for pregnancy and training for the lifetime events of birth. You'll have the full support of Vicky, who is the founder of the program, as well as other like-minded pregnant women following the program with you. And that's going to be available from tomorrow, and you will have lifetime access, and whoever wins that prize will get the access details sent to you via email. So I'm really looking forward to seeing who is going to send the 12 words in. And maybe, Vicky, what we can do is also share the winner and the 12 words that they wrote on our social media and all the follow-up emails that will be going out after the summit.
Definitely. There has been a slight delay on the program. It will be available to next Sunday. So sorry about that. I thought I'd better mention that now. But yes, next Sunday will be available to you. I'm so excited. So yes, do enter. And also, just before we go for halftime, Karen, just looking in the chat, and I would just like to thank all these lovely people that have come on and let me know how many weeks they are. So Estee, baby girl due 4th of March, fabulous. All right, so congratulations and best of luck and best of wishes for your birth. Tammy, thank you so much. And Tracy and Thabisco, I hope I pronounced that correctly, 16 weeks, 4 days today. So welcome, thank you for joining me. Sarah from Cape Town, 23 weeks. Lovely, congratulations. Leanne Coetzee, so in South Africa as well, and due this week, the 17th. So best of luck and lots of wishes to you, Leanne. Tammy, 24 weeks. Hello, Tammy. And Whitney, 15 weeks along, so fairly new. Johannesburg. Oh, so many. Sebastião, lovely name. I'm sorry if I didn't pronounce that correctly. 36 weeks, so close. Michelle, 18 weeks. And loads of you, Cecilia, Cape Town, 17 weeks. Hello, thank you for joining. Shiny, and you're 25 weeks. Sade, 9 weeks. Congratulations. Victor, 18 weeks. And Mardeline, 32 weeks. I'm in your 3rd trimester. Sammy, congratulations, 24 weeks. And there we go. So thank you. I think I've acknowledged everybody. If I missed anybody out there, then I do apologize. But thank you ever so much for joining me. I've really enjoyed today. Thank you for all of your questions. It's so important that we interact and you make the most of the summit today. This is just such a great thing that Karen has put on for you pregnant women out there. This is kind of one of its own, and the Due Date Club is just so exciting. It's a big community. You're going to get so much from it. So I'm honored to be here. Thank you so much for having me, everybody.
Thank you so much, Vicky. Thank you so much for joining me today. Once again, thank you to everybody who's joined, for your engagement, for your participation. I can't wait to hear what the 12 words are that you will be sharing with Vicky in order to get a copy of the Prepare program. I can't wait to see the Prepare program. Vicky, well done on putting that together. I know it's going to be amazing, and I'm so glad to be part of that. And I'm looking forward to sharing it in the Due Date Club with all the members, and for your monthly sessions with us, where you'll be coming in and interacting and answering questions with all the members of the Due Date Club. So
yes, thrilled to be doing that. So, you know, if you're going to be a member, which I sincerely hope you are, then I'll be speaking to you once a month and answering all your questions there too.
Absolutely. And I'm so glad, because so far we really are running on time and on schedule. For those of you who are here, now's the chance for you to go and grab a cup of tea or a snack, or if you're pregnant, you're probably got to peeing very often. So this is a little toilet break. I'm going to be putting a video on now as I connect with our next speaker, who will be starting at 11 a.m., which is South Africa time, GMT +2 or UTC +2. And that'll be in another roughly 20 minutes time, or about 15 minutes time. I'll be connecting again with Charlene. Now, our next speaker is Charlene Yared West. I'll just let you know, so that you know that what you're staying for or what you need to come back for. And I'm delighted to have Charlene, because I've actually collaborated with the program called Relax into Birth with Charlene, and she is a hypnobirthing specialist. She is the founder of the Relax into Birth online school. She's a professional clinical hypnotherapist, a pregnancy and postnatal massage therapist, and also a journalist. So she does a lot of birth and pregnancy writing. She's a doula, pregnancy and postpartum doula, and a placenta encapsulation specialist. She's been a doula for a decade, since the birth of her son, which launched her passion into birth. And I hope that she's going to share a little bit about how she came into doing hypnobirthing, because when she fell pregnant, she was absolutely determined that she was going to avoid everything to do with birth and have an elective cesarean section. And then has subsequently went on to have a home birth using hypnobirthing, and then once again founding the Relax into Birth online school and teaching hypnobirthing to parents. So it's a beautiful story, and she's an amazing teacher. She and as I say, it was a transformational birth experience. To date, she has supported over 350 women on their birth journeys, walking them every step of the way. She believes that each birth is a gift, each birth is a story in its own right, and she strives to empower women to have a better birth, no matter what turn it takes. After the birth of her son, Charlene went on to become a hypnobirthing practitioner, a birth doula, postpartum doula, and professional clinical hypnotherapist. Her extensive experience in the birth field and hypnotherapy, as well as her skills as a journalist, helped her to create the Relax into Birth online school, which is the first proudly South African online birth preparation school, teaching women and their partners hypnobirthing techniques and deep relaxation methods for a more comfortable and manageable birth experience at home or in hospital for natural or cesarean birth. Her aim is to inform parents of their options, to educate, empower, and mirror exactly what the mother needs, so that the experience she has is a positive one. And as I say, I have collaborated with Charlene on her course is Relax into Birth. We have a course called Relax into Birth Plus, where I include all the medical aspects and the physiological aspects of birth, and specifically giving birth in a hospital environment, because I know how different that is, and just bringing all the aspects of midwifery into that course. And that course will obviously be available in the Due Date Club as well.